I had the strong symptoms of imbalance. I had no energy or stamina. Couldn't even walk from the kitchen to the bedroom without sitting down in the living room.
Patients with really severe leakiness of their valves have problems with shortness of breath, edema of their legs, bloating of their belly, and just feel miserable from very poor output of their heart.
I really could not begin to do usual things. Couldn't do anything like walk around the block or lift anything.
Patients initially were felt to be too sick. If they couldn't have heart surgery, they really were told they had medications and that's all you could have.
One thing under consideration was open heart surgery.
And patients realized, and physicians realized there's other options to help make them feel better, improve their quality of life.
The doctors chose the clip on the mitral valve, and that has made a world of difference.
Now that we're able to do these procedures very safely for these people with very low risk and very low morbidity and avoid a major surgical procedure, patients as well as physicians, cardiologists, as well as internists are referring these patients to our practice.
I had a patient yesterday in clinic who started crying when she realized that it was going to be a one-night hospital stay, virtually no pain, and home with really minimal restrictions.
I can go out for dinner and have a nice evening without needing to lie down.
In terms of our program, Riverside Methodist Hospital is a tertiary center, high volume, a lot of complex cases. We have a mature heart failure department. We have several physicians that really have a key interest in the structural heart procedures such as MitraClip and tricuspid valve procedures.
So those are the communities that we want to reach. Those are the communities we want to touch so we can impact the life of those patients that had no option before, that the only option was open heart surgery. And that's our goal. I think we play a big role as physicians, especially in a leading institution like Riverside, to go out and educate as much as possible as a team. Before
we had the clip put on, I paid my registration fee to move from my own house to Wesley Glen, that retirement community. But I haven't moved yet because I'm living comfortably in my own house.